Good morning, Singapore. Welcome to The Big Show and The Big Show TV. It's Glenn, Angel, FD, and Shaun. And since it's a Tuesday, we're joined by the one and only, the beautiful Dr. Geraldine Tan from the therapy room.
Hey.
Good morning, Jerry.
Morning.
Morning.
Good morning, Dr. Jerry.
And we're not having an echo today. Yay.
Yay.
And Happy New Year, Jerry.
Happy New Year.
Yay! Only 21 days left.
Did we say Happy New Year to her last
We
week?
did.
Yeah,
Oh,
sure, we did.
Yes.
Yeah, we did.
But we
sorry,
can
sorry.
say it. We can say it throughout the year. It's fine.
She started the year with us.
Yes.
Okay.
That's right. She was our first guest
Yes.
back on.
Right.
Yeah.
That's true. I forgot.
I know.
恭喜发财! Jerry!
Is it too early
Now that
to
Christmas
say
is
Kong Si Fa
over.
Chai?
Oh, yeah, okay. I tell you what, I've got something
Yeah,
to do
we'll do
right
this
now.
first.
Wait, hold on. Glenn
a little
has
shout
something
out,
to
a little
do.
shout out. Hold on. This is to. Let me see now. Where is it? Where is it? Where is it? Where is it?
Okay.
Where is it?
You
Where
got
is it?
this,
Where
you
is
got
it?
this.
Okay,
Come
I
on.
got this.
Right.
Okay, so I've got a good friend by the name of Kevin. All right, and he has a beautiful daughter by the name of Jody May.
Oh, what
Okay.
a lovely name.
So, Jody went up to her daddy the other day and said, can Uncle Glenn say hello to all my friends in school?
Oh.
You know? And so Kevin was like, okay, since we played golf the other day, so I'm going to play golf with Uncle Glenn. I'll ask Uncle Glenn.
Okay.
So he did, and I said, absolutely.
Of course, yeah.
So Jody has come up with this little message, and I'm going to be reading it out right now. Okay?
Is this like a sad message?
No lah.
No, happy sound, happy sound.
So, Jody May, good morning from all of us here, uncles and aunties
Morning.
on the show.
Uncles only.
Uncles only. Okay.
And to
Anyway, Jody May just wants to say hello to all the parents, teachers, and students of CHIJ Toa Payoh.
Oh,
She
nice.
hopes that everyone has a great day.
Oh, so sweet.
Love, Jody May in Primary 1.
Oh, this is only her second week into school and she's already scoring points. Well done, Jody. Kevin taught you well.
Okay, back to regular programming right now.
All right, Dr.
We're-
Jerry.
We're talking about SPD this morning, Jerry.
Yes, sensory processing disorder.
What is it?
Yeah.
Yeah.
It is. Okay, so today's topic is a little bit difficult. A disclaimer. Usually, psychologists do not deal with SPD. So we usually have the occupational therapists deal with it. But we do see these children coming through our doors, and the parents are very clueless. So I think last year, one of the listeners mentioned that, let's talk about sensory processing disorder. So that's why we are talking about it today.
Okay, so you mentioned children. Is this specifically a children's disorder or
So
majority?
many of them are diagnosed during childhood, and it's very troublesome for some of the children, especially because they go to schools. And schools, you have a lot of comparison and you have a lot of stimulation. So sensory processing disorder, well, we know what the five senses are, right? What you see, you hear, you smell, you taste, you touch. What happens is their brains processes the senses very differently from you and I. So there can be an overstimulation or an understimulation.
Wow. Okay. So when you wow, I still don't quite understand it.
Yeah. How? So what you mean? Like if I smell curry, it's overpowering for me. Is that what is that what it is?
So for overstimulation, right? It could be that even if they are very sensitive orally, it can be even a grain of sand can be very painful for them.
Oh wow. Okay.
wow.
Okay. Okay.
Or if they are understimulated, you might have those that go spin and spin and spin and spin and spin, and they don't feel dizzy at all,
Huh?
and they continue to spin.
Wow, that's an advantage.
Wow.
And how many is this a very common disorder? Like, what percentage of children are diagnosed with this?
So it's not a very common disorder, yeah. So that's why sometimes it's also underdiagnosed or misdiagnosed, because many of them they show other sort of behavioral traits that can be mistaken.
For what?
Like what?
Yeah.
Like ADHD, so they may be
Right.
impulsive, they may so one very confusing one would be autism. Yeah, so the autistic child has the symptom of SPD, but a child with sensory processing disorder may not be on the spectrum.
Right.
Okay, of
So,
autism.
so
okay.
an autistic child, hang on, has the symptoms of SPD.
SPD.
Yes.
So
Does that
it
mean
is a
so an
trait.
autistic child has SPD?
Yes, so that it is part of the condition.
Okay. Wow. Okay.
All right.
Okay.
Okay, we'll continue to talk to Dr. Geraldine Tan on The Big Show TV. Meantime, here's New Order with Regrets on 1FM 91.3.
When you say there's sensory processing disorder, so could things like bright lights be affect kids as well? Loud noises as well? Can. Okay.
Anything to do with the
So it's
senses, right?
interesting because when I was thinking of doing, this topic, whether to do it or not, yesterday a little girl came to my session, and I think, when I spoke with the mother, it was all the classic symptoms of SPD, but she wasn't autistic at all. So this little girl, she would interact with the mom, and mom is a very gentle lady. She would interact with the helper, but she doesn't like the voice of her father.
Oh no. Okay.
So how the mom phrased it was, oh, the child doesn't like the father. And then later on in the session, oh, the father has a loud voice.
Okay.
Because this little girl came and she would not speak in class.
Okay.
Would not speak in class. So she came because the teacher said, oh, I've heard about selective mutism. Perhaps it is, But then we realized that the child had very sensitive ears. So when the father's voice is very loud, she can't take it. So even when she was sitting at the reception area in the center, the phone rang. She covered her ears immediately because it was so painful for the ears.
She cannot do my spin class then.
Yeah.
Jerry, you said this is normally diagnosed in children. But adults could get it, couldn't they? Because I had a friend who was and still does, with very bright sunlight, gets massive migraines. Would that be sensory processing disorder?
It probably needs to come with other things also, because there are some that are photosensitive. So even in movies, you see the disclaimer.
With flashing and
lights,
stuff. Yeah.
Can overstimulate some brains. Yeah,
Okay.
some people, right?
So
It doesn't mean that.
no, carry on. Sorry.
No. Go ahead.
So for this SPD, what's the most common sort of sense that is affected? What do you see more of? Is it more of the sight or the hearing, or
The smell.
the smell, the taste, or the touch?
I guess that is very overt, and we'll come to that. So
Okay.
there are three patterns actually, and I want to get it right, so I'm going to read. So I'm going to start with the sensory discrimination disorder. So one of the patterns is sensory discrimination disorder. The example given is they don't know the how hard to hold on to an object, because their sense may not be very accurate. They don't know how to deal with a situation. So this could mean that a child could hit, but hit too hard. So I want to tap a friend, but instead of tapping, I'm actually hitting a friend without realizing that I'm hitting the friend.
So they
Oh.
don't know their own strength.
Right.
Yeah.
I've got a 50-year-old friend like that. It's painful sometimes, I have to say.
Oh dear.
Yeah.
Okay.
I said, one more time, I'm going to hit you back.
But they don't know, right? Okay, the second pattern is sensory-based motor disorder. So they have difficulty with balance, with motor coordination. Yeah, and the more commonly heard and seen would be the sensory modulation disorder. They may be over responsive or under responsive or crave stimulation. Okay, so this one is more commonly seen. So you have the hypersensitive type that are very fearful. So they go up the slide and they dare not come down
Come
the
down,
slide.
right?
Oh, right. Okay.
Okay.
Yeah.
Shit, there are many people like that.
A bit clumsy. They appear a bit clumsy. They are very fearful of the stimulation that they would get. So
Right.
even riding a bike, trying new things, trying new food, um, even touching, getting them to touch textures, maybe something furry, and they go, oh, I don't want. So those are hypersensitive to different stimulation.
Are we still talking about kids here? We are, right? Mainly.
Usually we diagnose them in children, but the adults that may still manifest some of these behaviors because it doesn't go away. They
Oh,
manage
wow.
it, but it doesn't go away.
To be classified
Doesn't go away.
into one of these three patterns, do I have to have more than one symptom?
The diagnosis is usually done by the occupational therapist. Like I say, it's not within what we do. We do observe some of these behaviors, but the specific diagnosis usually is done by the occupational therapist.
So you said there is no cure for this, right? But there is a way to manage it. So there's like a healing almost process, but that's lifelong. It will never go away?
The earlier that we catch or we help the children to manage, the more comfortable they are in the environment.
Okay.
So I spoke about the hypersensitive group, right? But there's the hyposensitive group.
What's the hypo?
The hypo means that they are undersensitive. So they crave a lot of motion. So they are spinning, they are jumping, so they need a lot of that movement, or they need a lot of sensorial stimulation. So the little girl yesterday was very interesting. She would eat nothing except crispy and fried food. That means she needs that sensation.
Crunch and
The crunch.
everything.
Yeah.
That's very interesting because listening to this with the continuous spinning and with the need for this simulation, one would think that would be hyper
Yeah.
and not hypo.
Because you're
Yeah.
so hyper.
Because you're hyper.
But they don't feel giddy, you see, that's why. She was
Because,
saying.
yeah, that's
You know
true.
what I mean?
Yeah.
It's the
Yeah.
response in the
Yeah.
brain. Yeah.
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 Okay, stand by. We're going to go for a traffic update and then come back. Good morning and welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the Therapy Room, psychologist extraordinaire.
Yeah, one of the top 10 in Singapore, it's been proven. Dr. Jerry, good morning. Today we're talking about sensory processing disorder, also known as SPD. And on the Big Show TV, you were talking about how there are 3 patterns of SPD, mainly sensory discrimination disorder, sensorial-based motor disorder, and sensory modulation disorder. Can you just go through those 3 different patterns real quick for those listening on the radio, please?
Okay, so sensory discrimination disorder, where they find it difficult to understand what is they're dealing with. So it could be that, they might hold something too hard. They don't know how to deal with that particular situation. Sensory-based motor disorder, difficulty with balance, motor coordination. Basically, they have difficulty with body awareness also. And then sensory modulation disorder, difficulty in responding to sensory stimulation or stimuli. Maybe over sensitive or under sensitive, or they crave stimulation.
Damien Teo on our Facebook page says, "Morning, everybody. I'm curious, is this disorder due to signals misfiring in the brain, or so that it can happen in older people as well, because brain signals change as you get older? Is it about signals misfiring?"
The older part is really interesting, but it is the brain not processing the stimulation properly. So yes.
Is there a way to train the brain to process it better?
Yes, so that's why you have sensory integration therapy.
Okay. Okay. What does that involve? I know it might be very complicated, but just in like a layman's sort of explanation.
So the OT will guide you through a series of exercises to kind of retrain the brain to feel more comfortable with the different senses. Yeah.
Okay. And these can be done at home throughout the day and throughout the week, and you do it also when you're away from your occupational therapist.
Yes. So they would probably need a sensory schedule also, because it cannot just be a 45-minute or an hour once or twice a week. It has to be consistently introduced to the child or to the person every single day.
Yeah. This is what S.C. Lee said on our Facebook page. His son had sensory issues, and he went through occupational therapy for a period of time during primary school, and he says it's a lifelong learning process.
Wow. Okay. Speaking of which, I mean, as with every disorder, there is the very mild and then the very severe. What is an example of extremely mild, and what is very severe?
So if it's mild, it doesn't really affect your functioning. It might be very irritating, but it might not affect your functioning. You're in class perhaps, and you just find that everybody is really noisy. You learn how to hyper focus into something else, and you don't tune into the ambient noises, for example.
Okay.
So someone who gets irritated very easily, it's like they're irritated all the time because people get on their nerves all the time.
I knew a few
there might be an
prefects
issue. Okay.
Maybe. I mean, so you hear them say like, this place is very noisy. So they have, in children, it's easier to see. They have their temper tantrums. They have their meltdowns. And you're looking at them going, what's happening? What actually, did you hear, see, touch, feel? And they are not able to tell you because what they experience appear to be what everybody else is experiencing, but they are finding it so excruciatingly painful for themselves.
It's on a different level that they hear it or see it, right? Okay.
Yep.
Okay. All right. We'll continue to talk to Jerry on the Big Show TV. Meantime, here's New Kids on the Block, featuring a whole bunch of other people. 80s Baby on 1FM 91.3.
Oh?
Is this the 80s?
Just a quick reminder to everybody, if you do have questions for Dr. Jerry regarding the
SPD.
topic of sensory processing disorder, you can put them on our Facebook page and we will ask them. Lena has said hyposensitivity. Is it like running around and banging into walls and banging into sofas and things like that? Is that one of the things that happens with hypersensitivity?
Without more information, I
Very
don't
hard to
know.
say, right?
It could
I
be a
used to do
kid
that.
trying to play, right?
Yeah.
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 I walked into many trees when I was younger. Really?
You still do.
I still do.
You walked into those streets accidentally, not on purpose.
Not on purpose, accidentally.
Oh yeah,
Not on
so that's a great thing that Glenn just brought up. So when children do this with hyper or hypo, I think I can't figure out which one it is. Would they be walking into the trees or the walls or the furniture or whatever it is on purpose?
So if it is the sensory-based motor, what was that?
Modulation.
Disorder, it
Yeah.
could be motor disorder.
Motor disorder, right.
It could be that because they're not very aware.
Coordinated, right.
Yeah, and then they could bang into things, and that's why people say they are very clumsy. So what we hear, the narrative would be, oh, you're so clumsy, you keep banging into things.
Okay.
So that's not purposeful. So those with hyposensitivity, that means they're understimulated and they need to get that stimulation, would do it deliberately. So we have
Right.
kids that actually bang their heads because they need that sensation.
Wow.
I feel
so-
something.
Yeah, so some bite the inside of their mouth.
Oh dear.
Yeah.
And what
Yeah.
about things like scratching or picking at their nails and biting or whatever? Is that inclusive as well? Sometimes.
It may fall under that umbrella.
Wow, it must be so
But
hard to
still,
diagnose because they
it's
sound
another-
like. It sounds like something we've spoken about before, like with things like ADHD or autism
yeah.
and all the
Yeah,
other
yeah,
disorders that we've spoken about.
Which is why it's so difficult to diagnose all the different disorders.
Yeah.
So, just have the parents who are listening in, just bear with us, because sometimes we do need to have different, quite a number of sessions before we diagnose the child. We don't want to make a mistake.
Yeah.
Okay, so what can parents do? When do alarm bells have to go off and kind of tell you that, okay, I think my child needs to see a professional?
So you hear the parents saying, "Oh, my child is a very picky eater." So that is a really common sort of a script that parents say, right? But when your child is only eating one type of food, or they're not getting enough nutrients, then that's where you need to be concerned about.
Okay.
If the child is harming himself, right, then I think we should be concerned. When the child is not, or when even, let's not just say the children, but when an adult is not able to integrate into the environment, then that's where we need to be concerned.
Absolutely.
I was quite intrigued by the child being afraid of the father, and it's not because the father abused the child or anything like that, but because the father has a loud voice. So yeah, and why the child doesn't
Father was an army encik or what?
Not true.
But it could be loud only to the child, right? It may not be loud
Yes.
to regular people, not regular people, but other people listening in.
Yes. It could be a fraction louder, so you might listen in and you go, "Oh yes, Daddy has a loud voice."
Like FD's voice,
But
nah.
it is-
Like FD's voice. And then when he starts laughing like that, ha 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 ha.
You scare any
Now I'm
child.
controlling volume,
That's why.
You would scare any child.
I have been told that, yeah.
Oh no!
Yeah, once or twice, yeah. But that's interesting. If, like as Glenn said, someone like me, my voice scaring because of volumes. Peng Shin has come across and said, "What about external factors? Can these aggravate a condition?" We've talked about voice, but what Peng Shin is talking about is media images, things like gadgets, your phone, your iPads,
Like
your
screens.
tablets. Can these aggravate some of these conditions?
If the child is photosensitive or if the person is photosensitive, then you realize that you cannot be on your gadget for a very long time. No matter how much you dim the brightness, it will still make you dizzy, make you nauseous, it makes you uncomfortable in one way or another. So that's when it affects your functioning. You cannot do your work. But let's say if it's mild, you might just have a slight headache and you still can complete your work.
Wow. Okay. It sounds like I might have this as well. No, I'm kidding.
No, but we've got parents coming through who said that as their children go through the occupational therapy, it's a case of the parents have to learn with the
Of course,
child
yeah.
as the child goes. It's not just the child. The parent has to learn as the child goes through all the therapy as well.
Yes.
Is it just treatment or is medication involved for stuff like this as well?
For some.
Unless there are other things that are involved. Yeah, so if it's a comorbid with like ADHD or if it's a comorbid with something else, then maybe medication is required. But typically, the occupational therapist will deal with the disorder quite nicely.
So how do we behave or, around people who have SPD? Say we know someone has SPD. I mean, what should we do or not do?
So they look like very regular people.
So besides
And you
treating them like
not-
regular people, right?
Yeah, so just treat them as per normal. But sometimes they would be covering their ears or they would be very, very angry or upset. And you see the parent trying to settle them. The last thing you want to is to go over and go, "Hi, can I help you?"
Oh my goodness. Is everything okay?
Yeah.
Oh, that affected me.
Yeah.
He almost covered his ears.
Yeah, the child will go into another meltdown. Yeah,
Right.
But I mean, the parents can also take note of like even certain clothings, right? They have tags or
Itchy,
certain
right.
clothings are itchy for them.
Yeah.
It's not just the tags; it's the clothes
The fabric.
themselves.
The
that-
type of fabric.
Yeah, they say, "Oh, it's very painful."
Oh,
so
right.
parents can be alerted to it also. Yeah.
Yeah, but I don't blame them. I mean, I am very particular with the
Fabric.
fabrics that I
fabric.
choose. Because there are some materials that really do feel uncomfortable on the skin.
Yes. Yeah.
Like a
The
little
more
itchy
synthetic
and,
ones,
and
yeah.
But for them, it's so painful that they would not even, it's pain. They
It's
would just say
painful.
it's painful. Yeah.
Yeah, yeah.
right.
It's like having a really bad fever, and then
Yeah.
everything that you touch is kind of cold or
Yes.
painful when
Yes.
you touch it. Okay, all right.
Okay.
Yeah. The
Okay.
other one that parents can see would be the water
Water.
on the faces of children. Yeah.
Okay, let's
Okay,
talk
well,
about this.
that's fine.
Let's talk about this on the radio.
Okay.
Okay.
Good morning, Singapore, and welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the Therapy Room. And early on, we heard from Britney Spears. I think Britney Spears, if she comes to Singapore, should see you.
Yeah, absolutely.
Because I think she has, at this point in time, right, sensory processing disorder.
Okay.
She does.
Okay.
Yeah.
All right.
Listen, she's dancing and she's falling. And then, once in a while, she feels like it. She'll just take all the clothes off and then just pose, and send it out to the world. And we're going like, what's happening to you, Britney?
Okay.
And
her
she's saying,
latest pose on.
yeah,
Oh,
yeah,
no, no clothes
She's
on.
saying,
Oh,
yeah,
really?
finally, I'm free. And then
Free from
of
clothes.
clothes. So
Yeah.
I think
Poor girl,
something
man.
is
Poor
going
girl.
on there.
I really
she
feel
might
for
she
her.
might need to see actually a psychiatrist.
She probably already is seeing a few.
Yeah, she might be. She
Really?
might be.
Yeah.
Poor girl. Anyway, okay, yes, Shaun.
Oh, I just wanted to jump in real quick to congratulate Dr. Jerry because she won. I mean, the therapy room won Most Diverse Psychology Treatment Room 2022 and the
2022?
2022.
2022 in the Singapore Business Award. Very shy, so I must say.
Thank goodness
Well
we have
done.
you on our show.
Wow.
Only the best.
Congratulations, Jerry.
So much.
Well
So when
done.
can I lie down on your sofa? In your office. Okay,
You've been
still
trying to do
cannot.
that for years.
Right?
Jerry, you were talking about water on the face earlier.
Yep.
What?
So another complaint that comes through, and parents often say, is that they have difficulty showering the children.
Oh, it's painful?
No, so they can't. They don't like the water on their face. It's very
Okay.
scary for them.
It
Yeah.
feels like they're drowning or like waterboarding, that kind of feeling.
Oh,
Yes.
no.
Yes.
Oh, wow.
Yes.
What should parents do if something like this happens? Because I foresee if
Powder bath.
If yeah, dry bath.
Dry
right?
bath.
I
Yeah,
foresee
maybe.
that if the parent has not had the child diagnosed yet, and they're having a hard time giving the child a shower, how should they approach it?
Well, there are different methods making it fun for the child. If they know that the child is sensitive, the face is sensitive, there are shower caps that
Oh, right, like a visor.
different. Yeah,
wow.
yeah.
But I mean, because a lot of parents will think that the child's just being naughty.
Naughty,
You know what I mean? No,
exactly.
go throw you in the shower and sort of like put the shower over you and stuff like that. And clearly it could be a bigger problem.
Yeah, it could be. And if you see the child melting down, like really sobbing the entire bath time, and it's so painful. Yeah, painful for the parent to go through the entire charade of bathing the child. Then perhaps, it is time to look at the issue and see if there are other issues or
Areas.
other concerns, that the child is also struggling with.
Earlier on the Big Show TV, besides water, you're also talking about clothes and how it could be painful for some kids to wear the clothes. Can you go through that quickly and also speak about what parents should do if alarm bells start going off with, different sort of symptoms that they might be facing or disorders?
Maybe Britney
Yep.
Spears finds it painful to put her clothes on.
After all those like
Britney
red leather
Spears
suits
and the
that she used to
clothes.
wear.
Oh
and
my
everything,
goodness,
right?
yes.
So she's like, get off.
Yeah.
Some fabrics, some materials can be very painful for the child. So they would describe to you as it's scratchy on the skin, it's painful for the skin, it hurts me. So that's not very typical. So some of the clothes, yes, we know is a little bit stiff and uncomfortable. And we know that, stop fussing, you have to wear it and it's a little bit harder, but later on you can change out and they are typically okay. But these children with sensory issues, they cannot even touch it. Sometimes it's so painful. You make them wear it and the entire day is simply just ruined because they are so focused on the pain.
Oh, wow. Okay.
Yeah.
I have a question that it's been nagging me at the back of my mind. So you diagnose a child with this at a young age. They go through occupational therapy and they learn to control it. This is a boy. Male child. How does this child then do national service?
Oh, my goodness. Good question.
Can they?
MC.
Can they?
Well, it depends. If let's say it's only one specific area, okay, and it can, so maybe it's only one sense, and it doesn't affect, the rest of the functioning, go ahead. But if it is, I cannot wear the uniform, I cannot stand loud sounds, I need to eat certain types of food, and it affects so many different areas, and the child or this young man becomes a danger to his entire squad, please talk to your doctor.
So
I do not want to put anyone else at risk.
Yeah.
So there are people that may only have one sense affected or all five.
Yes.
Oh my
yes.
goodness! Wow.
Then you will be excuse uniform, excuse marching,
Yeah.
excuse outfield, excuse everything.
I-
Excuse
Yeah.
army, boy.
I'm
Yeah,
listening to this
completely.
and I cannot even comprehend not being able to deal with my senses.
yeah.
I can't even comprehend that
But
feeling.
if it's something that is it something that you're born with?
It's something whether nature or nurture is it? Usually is nature.
Okay.
Yeah.
Okay.
Usually.
Nature.
If someone is trying to, someone listening right now suddenly gets the idea that he wants to use this because he's about to enlist in the army, right? I mean, he has to be diagnosed with this problem, right? And it's not,
It's not as simple as
Yeah,
just going
it's
in
not
and
as
getting an
simple,
MC
yeah,
or
it's
anything.
simple.
yeah,
no.
no.
yeah,
No.
because there's some very good actors.
This one cannot go polyclinic.
Yeah, no. I think you're going to have a proper therapist
From the therapy room.
Yeah,
from
they'll
the
have to diagnose you.
Yeah, you've
like,
got to be properly diagnosed, I guess.
Yeah. Wow.
Okay. All right.
Okay. All right. Up next, Mike and the Mechanics. Here's All I Need is a Miracle on The Big Show, 1FM 91.3.
I may have just found it in SPD.
Okay.
Okay.
Dr. Jerry, we also have we also have the pineapple tarts that you
Yeah.
sent us.
Oh,
What pineapple tarts?
Yay!
Surprise!
Pineapple again.
What?
Yay.
We just had some pineapple
Yeah,
tarts from
yesterday.
Violet Oon yesterday. And
Yeah.
so these are pineapple tarts you made.
No,
Did you
I
make-
didn't make
She's
it.
like,
I didn't make
Okay.
it.
Absolutely not.
Oh.
Oh,
we each get a
a
bag.
different color. Can we choose
Yes.
the color?
Wait.
Sorry.
Have a look at
Charlene is
that.
bringing them out.
Jerry was showing us something just
Sorry,
now.
Dr.
What was
Jerry,
that?
what was it?
Thank you.
You would get them in different bags.
Yes.
The beige. Yeah,
Yes.
give him the pink.
They're
Yeah,
all
Glenn
different
likes the
bags.
pink.
Thank you.
Yeah, they're all
Ah,
in
yeah.
different bags.
So can we. I like it.
Beyond social services, I
What
remember
can-
this.
What can I put in this
Yes,
bag? It's so
yes.
small.
If you don't want it, I'll take it.
Wait till you hear the story, Glenn. You must hear
Story,
my
hear the
story.
story.
It's the same as last year. Were they the same? Was it
Yes,
the same group
yes,
as last
yes.
year? Yeah.
Yes. So, Bakers Beyond. So this year we have 5 dedicated bakers that helped us bake all these pineapple tarts. So big love and shout out to all of them. And this year we helped another group of ladies, and these ladies are the seamstress from
So can you. I like it. So can we. I like it.
Yep.
So
Yep,
can we.
yep. Yeah, and all these fabric are upcycle fabric. So
Nice.
they use the different fabrics that have been donated to them, and you can see how intricate their sewing is.
Yeah, it's
so we
really
had
good.
another group of them that helped us with the New Year bags also.
So sweet.
I love it. I love it.
I like the bags.
Yeah, so can we. Yeah, I
Yeah.
like it.
I know what to do with this bag
What?
already because it's quite small.
It's
you know,
a
all my
small
bags
bag,
are.
yeah.
I can put golf balls
I was just about
Yeah,
to say.
you
Yes,
can. You
yes.
and
Yes,
then
you
go on the
can.
course like
Absolutely.
So
You know what you
cute.
can also
Practice
use
my
this for?
putting-
If you go to the
putting
wet
green.
market, you can use this for things like your onions and your garlic and your chilies in a small bag. It's a little
Yes.
produce bag. Love
Yes.
Is it
Great,
waterproof?
Jerry.
Is it waterproof?
We'll find
No,
out.
it's
it. No, it's not waterproof. No.
And
Things will
they're
get
so sweet. So all the bags that we got, I realized comes with a base.
A
Oh, I
base,
was
yeah.
wondering what
Yeah.
that
Yes,
was.
yes, yes.
Right,
Base.
right, right.
Base
It's
to
a
put the-
base.
Yeah.
Quickly slipped, cut and slipped all
Yeah,
these
effort,
bases.
effort.
No, but you know what I mean?
Into our bags.
Dual purpose. On a hot day,
It's a fan.
It's a fan.
I thought it was an exercise for our sensory.
let me just it's a good fan. No. Really,
I
it
see.
is. It
It's
is a
alright.
very
Yeah, it
good
would
fan.
be.
It's multi-purpose. Okay, it's good for the golf course then.
Thanks so much, Jerry.
Thank you, thank you.
Thank you, Jerry. We love you.
Thank you to Bakers Beyond as well as So Can
Thank
We.
you. Thank you very much. Because beyond, these 3 ladies are looking more and more like Destiny's Child. I have to say. Good morning to the 3 of them.
Beyonce, Michelle, and Kelly.
They're gonna love you after this.
Pineapple tarts. Enjoy the pineapple tarts. They I think many people have tried and they said it's really, really nice. I haven't tried it yet.
My husband's gonna love you because he loves his desserts and sweets. So there you
Oh,
go. That's all. for
So
him, yeah.
dangerous, no?
That's all. For
Very
These are the
dangerous.
most dangerous type of
Pineapple tarts?
pineapple tarts, man.
I had one yesterday, went home, came back, the counter was finished. I was like, all gone. He's like, what do you mean? There was only one left in there. I'm like, no, there wasn't.
It was one serving for
Yeah.
him.
Yeah.
You know, we're starting to get all these
Yes.
snacks
Yes.
for Chinese New Year now.
Yes.
The bak kwa,
Oh,
the
yeah.
nian gao, the different types of
Pineapple
pineapple
tarts.
tarts, the cookies.
The cookies.
Oh my
Oh,
goodness.
they're all there on my island top. You know, I'm like looking at them every day. Jean has finished the those fish ball crackers.
Crackers.
It's like
The small ones.
fish.
Oh, yeah.
right?
It's a cracker,
Yeah,
savory,
but
right?
they look like
yeah,
fish balls.
balls,
they're fish
yeah.
crackers.
Finished,
Love
man.
them.
Finished. She
Love
watched
them.
one episode of a Korean drama.
Oh,
Three
those-
quarters of the thing was gone.
Those go really well with sambal belacan as
Yeah,
well. Oh
goodness.
my
Oh my
goodness.
God! Yes.
Oh, wow.
Once
Okay.
everything I
Hey, Jerry, getting back to our topic, here's an interesting comment from Rachel Lau. She says, without therapy, will children with SPD slowly get used to their condition if they are gradually, say it's sound, gradually introduced to louder sound? Is it possible without therapy?
Can they be sensitized if, let's say, it's or something that is not too excruciating, and they gradually, I don't know how to do it gradually, but they help themselves to manage it. For the milder ones, it is possible, but if it's already severe and they can't even sit in a classroom, for example, they can't listen to the teacher, so it's going to be very disruptive to their lives.
Yeah.
So those would be the ones that would be flagged up and go for therapy. But yes, those milder ones, they can learn how to manage it. They can learn how to navigate past all these.
So would children with SPD be able to attend regular school?
Yes.
Okay.
Yes, absolutely. So some of the children, you would see them wearing earmuffs, and I'm very, very
Right.
pleased that the schools are more inclusive now and more open to embracing
Yeah.
different tools.
Wow.
Back
So
then, back
it's
then.
just
No.
Yeah.
So just like what you all are wearing, right?
Yeah.
It looks similar to a headphone, but they're called earmuffs, and it pipes nothing into their ears. It just cancels out loud noises or ambient noises.
But they can still hear, but it just buffers the ears
Yes.
from the sounds. Okay.
Yes.
Wow.
Okay.
Or
quite
they would
something.
permit fidget toys,
Right.
you
Yeah.
because
Okay.
those that are hyper-stimulated needs the fidgeting.
What about
Yeah, and
things
you
like
don't want them to
clothes?
click.
What about things like uniforms and stuff like that if they can't wear their school uniforms?
Excellent question. So some of them we've worked with the school. So the harder material, like the stiffer shirts,
Yeah.
may be very uncomfortable for the children, but they can tolerate their PE attire.
Ah, like a T-shirt, right? Okay.
Yes. So it's still uniform, but they are
Okay.
permitted to wear their PE attire, instead of that harder, stiffer shirt.
That's
Yeah.
great that schools are becoming more inclusive, because back
Yeah.
in the day they'll just say you're a rebel, complain to your parents,
Yeah.
kick you out of
Detention,
school,
right?
yeah.
Hey, but
And
those
just say
shirts
you're
were
difficult.
but those shirts were only stiffer because I mean,
Starch.
yeah, mom used to
we had to make
iron
them
it with starch, right?
crinkle free,
Stiff,
right?
right?
Yeah,
Yeah.
crinkle free.
Yeah.
No, but some of the cotton shirts, right, still feel very painful for these children. They just cannot tahan. It's very tough for them. Yeah,
And
it
sometimes they
scratches on
wear
their skin.
extra shirts inside, maybe to sort of buffer the hard material on their skin.
Yeah. Yep. So if they can manage it, they can wear a shirt inside. Yeah.
Okay.
But some of them in Singapore weather, it is very hot.
But I'm sure there's still a lot of resistance from the schools and public and all that with kids like this, or you're seeing it. The awareness, they're being more inclusive, or there's still a lot of ways to go.
Let's talk about this on the radio,
yeah.
okay?
Okay.
Angel can
Yeah.
answer that question
Okay.
again. The Coors begging for some love. Love me. What can I do right here on The Big Show, 1FM 91.3. It's a lovely Tuesday morning, made even lovelier by the presence of one Dr. Geraldine Tan from the therapy room. Thank you so much for talking to us, Jerry.
Dr.
She's
Jerry,
shy.
today we were talking about sensory processing disorder, and just on the Big Show TV, we were talking about kids in school and how kids with SPD can go to and do go to regular schools, and schools are getting more inclusive in terms of allowing them to wear ear muffs to buffer the noise, and PE t-shirts instead of the stiff t-shirts. So a lot of awareness is among the education system and the parents, but what about awareness amongst their peers? How is that being created in the community?
Yeah, so that is a little bit tougher. So schools sometimes they are trying to be more inclusive, but they have not learned how to express it to the children or to share it with the children. So it's still regarded as something wrong. There's nothing wrong. Yeah.
Because I think they spend the most time with their schoolmates, on the school buses, at the bus stops, or however they travel, and then in the classrooms as well. So wouldn't that be the most important step, is to educate the children, to get them to know that there are these disorders out there?
We are getting there, but there are so many different disorders. I think the education system has to pick and choose which one they want to share also with the children. So so the children are talking about stress now. I do know my little girl would point out her friend and say, this friend has anger management and this friend
Oh my goodness! Wow.
Hey, we all have friends who have anger management issues.
Yes, a lot.
So, no, which is a good point actually to bring up, because for those people who are listening to us right now and who have certain issues, and we've been using the word disorder and stuff like that. I hope they don't feel too bad. I think as long as you're going to get some help, you're seeing a psychologist or a psychiatrist, perhaps. Understand that everybody, I think, has some form of disorder.
Disorders, absolutely.
Yeah.
Right?
Absolutely.
So we hope and we pray for your recovery, and perhaps maybe keeping everything in check and in control.
Jerry, I just want to ask you this question. We've been talking about these disorders and children in school, and we've been doing this for more than a year. My question is, we just talked about how we introduce this to the children. How are schools handling this with the teachers? How are the teachers being trained? Are there courses that teachers go to? Do you go to school and help explain this to teachers? How do teachers learn about this?
So really, really great question, and very proud to say that MOE is pushing a lot of courses for the teachers to educate them. I think the classroom management, the teachers have already gone through, but more than that is how do they recognize learning disorders? So they have courses on that. They are coaching teachers to recognize the warning signs and symptoms of suicide, which is excellent. So even the different disorders, I think they need time, because there's so much to learn and so many things, for the teachers to deal with also. But they are doing it step by step. So don't blame the teachers too much.
Yeah, right.
Okay.
No
Yeah,
doubt
for
about
sure.
that. Well done, MOE.
Good job.
For
Good
sure,
job.
for sure.
All right. Jerry, thank you so much for joining us this morning. As always, before you leave us, some wise words from Dr. Geraldine Tan, please.
Not me. Today we have Benjamin Franklin. And
Who's
I
that?
want to still answer.
I'm just kidding.
He's so naughty. Anyways, he says, teach me and I forget. Tell me and I forget. Teach me and I remember. Involve me and I learn. And it applies to anyone and all of us.
Love
Awesome.
it.
Love it, Jerry.
Thank you so much, Dr.
What a
Jerry.
wise man as well.
Yeah. Yes,
Benjamin
he was.
Franklin.
Yeah, he should
That's
have
why-
been like rule the country or something.
Hey, you know what? That's why I always say it's all about the Benjamins. Right.
Thanks, Dr. Jerry. We won't be seeing you next week because we have our first year anniversary. So it's our birthday. We will see you the week after that, which is opposite day.
Will do.
But Jerry, if you wanna just she can't check in. in on that day?
She can
Because
send a
of-
video.
She
She can send us a video.
That'd
Yeah.
be great. Actually, Jerry,
All the
Nat,
contributors can do that.
Julian,
Yes.
Sean.
They've done it before.
Sean,
They can do it again. They have practice. Yeah.
That'd be great.
All right,
That'd
we'll
be
talk to you
awesome.
offline.
Jerry is also wondering, like what Sito was saying.
What?
I almost called Sito Keto.
Keto,
It's KF Sito. Yeah, because Sito was going, what? Only 1 year? We've been on the show for 2 years already. What? So I
That's
think
right.
Jerry's probably thinking the same thing right now.
Yeah.
So the big show is celebrating our first anniversary.
The big show.
Big show.
Just
For the big
Right,
show.
right.
for the big show.
Oh
Yes.
my gosh, the big show is already 1 year
It
old.
just
Yes.
dawned on
Yeah,
her.
exactly.
It just dawned on her.
Involve her and she will learn.
Yeah, that's it. Well done, Sean. Well done. Well done.
You tell her she don't understand.
Sean's
forget.
learned.
Okay, thanks so much,
Thank you,
Jerry.
Jerry.